Hi, I hope you guys are having a great summer so far. I just wanted to make this quick video to let you know of the upcoming changes to Medicare for 2025. Due to the Inflation Reduction Act, we are expecting some significant changes to Medicare and Medicare benefits for next year for 2025. The biggest change is going to be regarding Part D prescription drug coverage. You guys have Part D drug coverage through your Medicare Advantage plan currently. And with the changes to Part D drug coverage, the biggest change is going to be that next year, you're going to have a $2,000 max out of pocket for prescription drug costs. For this year and for all previous years, there's never been a true maximum to what you could pay on prescriptions. And there was also a stage called the coverage gap or the donut hole. If you're somebody who doesn't know what the donut hole is or the coverage gap, that means you didn't hit it. But those of you that do hit the coverage gap or donut hole, you know it because your co-payments, your costs for your prescriptions, they increase significantly during that coverage gap or donut hole. So for 2025, that coverage gap is going away, which is going to be great news for people who have expensive prescriptions or will need expensive prescriptions in the future. So for 2025, you still have stages to your prescription drug coverage. The first stage is going to be the deductible stage. A deductible is an amount that you have to pay before your insurance pays anything. Not all plans have a prescription deductible, and not all prescriptions are subject to a deductible. So, however, but once you meet the deductible, then you move into the initial coverage stage. And at that point, you're just paying co-payments based upon the formulary, which is the list of covered drugs. It's based upon what tier your prescription drug is on the formulary. Then if you hit $2,000 out of pocket for your prescriptions, you will then reach catastrophic coverage, which is the final stage of your prescription drug coverage, and you will no longer have any co-payments towards prescriptions. So again, this is great news for people who have expensive prescriptions. I expect you guys to see some savings for next year. However, the flip side of the coin is now that the insurance companies are having to pay more out of their pocket for prescription drug coverage, they're going to have to offset those costs somehow. And we don't know exactly what this looks like yet. We don't find out what the plans are doing until October 1st. But we are expecting there to be a cutback on some benefits. So again, not only is this prescription drug coverage, the new coverage starting for 2025, but there's also been some Medicare reimbursement cutbacks. So these insurance companies are not getting as much money from Medicare. So they're having to pay more towards prescriptions and they're not getting as much money from Medicare, which means they're gonna dial back benefits. And again, we don't know what this looks like. We're expecting possibly some plans to end maybe in some counties in the surrounding Houston area. We don't really know. We could see some higher co-payments, some higher maximum out of pockets for your medical services. And we could also see them dial back some of the extras, some of the dental, the vision, the hearing, the over-the-counter items, gym memberships, and things like that. So what I need from you guys is come September, you're gonna get your annual notice of changes from your insurance company. You're gonna find out the changes to the plan before I find out. I find out on October 1st, okay? When you get that annual notice of changes in the first couple pages, I need you to kind of look those over. It's gonna tell you what the benefits were for 2024 versus 2025. And again, if you see benefits being dialed back, if you see costs going up, we're expecting that to happen, okay? Also, what I need from you guys is to also keep an eye out for any correspondence that you're getting from your insurance company directly. Because if they make changes to your provider networks, if they take prescriptions off of the formulary, maybe they were covering prescriptions before, they're not covering it for 2025, they're gonna notify you on an individual basis on any prescriptions or providers that are being affected. There's no way for me to know specifically how it's going to affect you on an individual basis. So as you're getting any correspondence from the insurance company regarding things like that, I need you to reach out to me. And we can evaluate other plan options for 2025. But what I'll say is I'm not just expecting this to only hit one insurance carrier. I'm expecting all insurance carriers to cut back on some of their benefits. So just because the benefits are getting worse for next year, if that happens, that doesn't necessarily mean I'm going to recommend switching your plan, but we do need to look at it if there's network disruptions or prescription drug disruptions. So I will keep you guys posted as we know more. I will be reaching out in early October, sending out videos going over the plan benefits for 2025 for your specific insurance plan. But I just wanted to take this quick minute to just kind of let you know that yes, we're expecting some changes. This is going to be a year of disruption for 2025, but don't panic. I will walk you through it. We may or may not need to make a change to your plan, but we'll know more come October. If you guys have any questions, let me know. Otherwise, I'll keep you posted and we'll talk to you soon. Thank you.